94.1 WHRP, today's best variety of R&B. Tony in the morning at DJ Primetime 256 Wellness Wednesday with our favorite Dr. MDPC GYN, Dr. Whitney West. Oh,
Morning, Dr. West.
Good morning.
good morning, Dr. West. Well, another great health tip and of a lot of concerns when it comes to menstrual health for women. Of course, the common myths about menstrual health. Let's get into that. Tell us about the common myths about menstrual health.
Well, one of the first ones, this is an uncomfortable topic for many. So,
Yeah.
and of course, we're on morning radio, so we need to make sure that we're mindful of that. But one of the main concerns about using different products
Mhm.
that will change whether you're a virgin or not. Um, and as we know, virginity comes from whether you've, had relations, before. And it has nothing to do with what you've inserted for menstrual care.
Mhm.
And that means like a tampon. There are things called menstrual cups
Mhm.
now. That's pretty new. But inserting those does not change whether you're a virgin or not. And there are some, cultures who want to maintain the hymen, but until um, uh, marriage. But this doesn't change that, doesn't break the hymen and that kind of thing.
Okay. So we can take that off the table. And when people are using tampons for their menstrual cycle, and as you just said, virginity coming into play. What about those that have what there is known as an irregular or a regular cycle? What's the
So
difference?
So irregular means the timing, and it could also mean the amount of flow, how many days it lasts. So, but irregular, usually we refer to that as the timing. So, a normal regular period comes about every 28 days, and that means the first day of one period to the first day of the next period. There's about 28 days in between, and ovulation happens. That's when you're most fertile, is 14 days before that period. When it's irregular, then the timing of ovulation is off because of several reasons. It could be medication, it could be over exercise. Like those who are athletes sometimes have no period because of their exercise schedule and their body fat content. So there's lots of reasons why your period could be off or irregular, but it's no longer 28 days between the first day and the first day. It could be 35 or 40. It could be 21. Then we worry about the amount of bleeding that you're having. So usually more than 7 days of really heavy bleeding is not normal.
And that's when you want to get some medical attention. Uh, are GYNs, are you ever concerned at a certain age how early someone may start their menstrual cycle?
So yes, we are concerned now because the food is has been tainted. There's antibiotics in food. There are steroids in meat. We're talking about protein now. Then there's other chemicals that are inserted into foods that will cause disruption of the endocrine system, which means that we could start periods early. They could be late. We could have problems with weight, so obesity that can affect whether your cycle comes on a regular basis or not. So, chemicals and those kind of things are really concerning because it can cause what we call precocious puberty. So, you have a 7-year old who's developing breasts and hair and needs to wear deodorant and then starts their period at 9. So,
Wellness
we do worry about that.
as well as Wednesday, and we're talking with Dr. Whitney West about common myths about menstrual health. Dr. West, I've got a teenager, and I am trying to figure out like what is the difference or health benefits with a tampon versus a pad.
So those girls who are active, let's say athletes playing sports, they want to swim. It's summertime, that kind of thing. Tampons are much easier to maneuver than a big old bulky pad.
Oh.
I had my daughters play soccer, and I remember one year I think my oldest was 12, and they changed the color of the shorts to white. And I could
Mm.
not believe why they would do that, because everybody's having issues at 12 years old. Why would we
Yeah,
want white
and
shorts?
as a former teenage athlete, I can relate to that, and also how the clothes fit, and feeling embarrassed because it is, a real sensitive situation. You're a young girl and you're going through this puberty time of life, and how can people be supportive? I remember having either my hoodie or my sweater I wrap around my waist,
Hmm.
during that time, just because you feel a little inadequate and a little bit embarrassed during the time of your menstrual cycle. Now, some of us actually deal with a lot of pain. How can we relieve the pain through this time of the month?
Well, that's interesting, because everybody wants to use what is advertised on the shelves that say this is for period cramping. The problem is that what's in some of those are actually don't help with cramping at all. I don't want to use any names, but there are some that actually say this is for period cramps, and it actually doesn't help because of the type of medication that it is. The things that will work, exercise. Actually, some people think they shouldn't exercise or can't because I'm in pain. It makes it actually better. Makes it better. The other thing that obviously there's some foods that could help. There are decreasing the amount of red meat that you're eating. You can also use medicine. Ibuprofen is one that they're called nonsteroidal anti-inflammatory drugs. Any of those will work. If you get that started at the moment that you start to feel cramping, and then you take it for like those first 2 days, that should help with them getting worse to the point where, because some girls are, and women are, laid out on the floor like they can't function. So if we can catch it before you get to that point, um, then we can get them in some kind of situation where they can function normally. There's some other herbs and medicinal things that you can use, natural remedies. One of them I've actually given to my own daughters is called cramp bark. You can get that on Amazon or whatever. But it is bark that is in it can be in liquid form or a tablet form, capsule, whatever. But take that with some calcium, 500 milligrams of calcium, and that helps relieve some of the cramping.
One more question, Dr. West, before we wrap things up. And I think I'm going to ask the question everybody wants to know. Can you sit in a bath water? Can you sit in a tub of bath, and take a bath, or should you just use the shower during that time?
You can take a bath. Everybody's different. The bleeding can be so heavy that you want to get in and out as fast as possible. But tubs are fine. It does not going to change anything. It actually might help you feel better if you're sitting in a tub of some Epsom salt, because it has magnesium in it, and that helps with relaxation.
All right, Dr. Whitney West, we are talking about the common myths about menstrual health. We certainly appreciate all these tips and the insight. Tell us how we can get in contact with you.
My website is www.westmdpc.com.
And what are your parting words?
Empower Wellness is a journey, not a destination.